Welcome back to the deep dive. It's always amazing how conditions we think we know, like chronic obstructive pulmonary disease, COPD, how they show up so differently across the animal kingdom.
Yeah, it really is.
We might think of humans, maybe horses with heaves, but it turns out other animals face similar breathing struggles, but the reasons behind them totally different sometimes.
Exactly. The symptoms might look familiar on the surface, but the why can be worlds apart.
So today, that's what we're digging into, this contrast. We're looking at COPD-like respiratory issues in, well, two quite different animal families. Camelidae, that's your llamas, your alpacas, and Cervidae, so deer.
Two very distinct groups.
Our mission here is to sort of unpack the causes, the signs, the challenges in diagnosing, and how these conditions are managed. Basically, a shortcut to getting the key differences and maybe some common ground. I'm really curious what drives these big distinctions. What's the frame we should use?
Well, what's fascinating here is that difference. You might see coughing, difficulty breathing, similar signs, but the actual biology, the environmental triggers, often completely different stories.
Okay.
And understanding that isn't just like academic. It's genuinely crucial for animal welfare, for productivity if we're talking livestock,
Yeah.
and really vital for conservation in wild animals too.
Yeah.
Every species has its own context, its own evolutionary niche, and that shapes how disease works.
That makes perfect sense. Okay, so let's zoom in on the camelids first, llamas and alpacas especially. What does this COPD-like condition look like in them? Is it really like heaves in horses?
It is, increasingly so.
Yeah.
What we see in camelids lines up remarkably well with equine asthma, or heaves. It's fundamentally a non-infectious inflammatory airway disease.
Not infectious, okay.
Right. So it's not just a cough here and there.
Yeah.
It's this chronic, progressive inflammation that really starts to limit their airflow over time.
So if it's not an infection causing it, what is? Is it environmental? Maybe allergies like humans get?
You've hit it exactly. It's definitely multifactorial, no single cause. But environmental triggers are, well, huge, undeniably central. It really looks like an allergic-type hypersensitivity.
Yeah.
Their immune system just overreacts to things they inhale.
Ah, okay. So what kind of things in their environment are we talking about? What are the big offenders?
The main culprits are airborne irritants. Things like dust and molds, especially from hay and bedding. That's a really big one if they're housed indoors or, fed in more enclosed areas.
Right, like stabled horses.
Precisely. It's a very strong parallel. Environmental pollens can add to that allergenic load, too.
Yeah.
And poor ventilation. That just makes everything worse, concentrates those irritants. There might be a genetic component, some predisposition, but honestly, the environment seems to be the much bigger driver here.
Wow, it's incredible how much their immediate space matters. So physically, what's going on inside their lungs, their airways, when they breathe this stuff in?
Well, pathophysiologically, you get this chronic inflammation kicking off deep in the lower airways. That sets off a cascade, really.
A cascade?
Yeah, first you get bronchoconstriction. The airways actually narrow, tighten up. Then the body produces excessive mucus, which, further clogs things up.
Okay.
And over the long term, the airway walls themselves can actually change, thicken. It's called remodeling. Put all that together, the narrowing, the mucus, the thickened walls, and you've got serious airflow obstruction.
That sounds awful.
And if it keeps progressing, unfortunately, it can lead to emphysema. That's where the tiny air sacs, the alveoli, where gas exchange happens, get permanently enlarged, damaged, even destroyed. That severely impacts their ability to get oxygen.
Just devastating. But you mentioned camelids are pretty stoic creatures. Does that make it harder to spot this early on? What signs should we look for, even the subtle ones?
That's a huge challenge, yes. Their stoicism means the early signs can be incredibly subtle. Often, the disease is pretty advanced by the time it's obvious.
Right.
So you're looking for things like a chronic, persistent cough, especially if it happens when they're eating hay or stirred up dust, exposed to those allergens, shortness of breath, or dyspnea. You might notice they're working harder to breathe out. A general exercise intolerance, they just don't have the same stamina. In more severe cases, you'll see obvious signs like flared nostrils, maybe even breathing with their mouth open. Sometimes you can hear wheezing or a harsh sound called stridor.
Wow.
And importantly, sometimes respiratory distress can come from the upper airway, not the lungs, which can confuse the picture. In really bad cases, you might see systemic effects too, weight loss, poor appetite, just looking generally unthrifty. That tells you it's taking a major toll.
Okay, so if those signs are present, how do vets figure out this is the problem? And given it's irreversible, what's the plan? How do you manage it? What's most important?
Diagnosis really starts with a good clinical history. What's been happening? When did it start? And a thorough physical exam. Listening to the lungs, observing their breathing.
Makes sense.
Then you might move to advanced diagnostics. Chest x-rays, thoracic radiography can show changes. Endoscopy, putting a camera down the airway, lets you actually see inflammation, mucus, maybe even collapsed trachea.
Right.
And a procedure called bronchoalveolar lavage, or BAL, where you flush a small amount of fluid into the lungs and collect it back. Analyzing that fluid can show inflammatory cells, like neutrophils and eosinophils, which often point towards that allergic response.
Oh, okay.
Sadly, sometimes diagnosis is confirmed post-mortem, revealing things like interstitial pneumonia and emphysema. But for management in a living animal, since you can't cure it, the focus is all about controlling symptoms and slowing it down. And the absolute #1 most critical thing, environmental management, reducing those triggers.
Here's where it gets really interesting then. That direct environmental link. Can you give specific examples? What do those changes look like?
Absolutely. It's all about minimizing that dust and mold exposure. So things like soaking hay before feeding or steaming it.
Yeah.
Some people switch to haylage, which is less dusty. Making sure barns or shelters are really well ventilated is key. Using bedding that's low dust. Basically identifying and avoiding the specific allergens for that animal as much as possible.
Right. And medications.
Medications can help manage symptoms. Bronchodilators, like albuterol or clenbuterol, can help open up the airways temporarily. Corticosteroids are used to reduce inflammation. Those can be given systemically, like pills or injections, say dexamethasone or prednisone, or sometimes inhaled, like fluticasone, directly into the lungs.
Does that work well?
Well, here's the thing. The actual efficacy of these drugs in camelids isn't super well established yet. We use them, often based on how they work in horses, but they need to be used cautiously. They're not a magic bullet.
Got it.
Other supportive things might include mucolytics like N-acetylcysteine to help break up thick mucus, making sure they're well hydrated, and just keeping their environment as stress-free as possible.
So a really challenging picture for camelids, very tied to their immediate surroundings. Does that same environmental sensitivity apply to deer? Or is it a totally different story for cervids with COPD-like symptoms?
That's really the core difference we're talking about today. For cervids deer, a specific allergic-based COPD like we see in camelids, it's just not really documented in the same way.
Oh, interesting.
Instead, when deer show those kinds of clinical signs, coughing, difficulty breathing, it's almost always linked back to something infectious or parasitic, or it's a secondary problem stemming from another disease entirely. We're generally looking for a bug, not an allergy trigger.
Okay, so pathogens are the main story here. What are some of the big ones affecting deer?
One of the major players is parasitic bronchitis.
Lungworm.
Lungworm. That's a significant issue in many deer populations.
Lungworm, yeah, that sounds bad. What causes it and what does it do inside the deer?
It's caused by infection with large lungworms, typically the genus Dictyocallis. The adult worms actually live in the bronchi, the larger airways. And their presence triggers this really intense immune reaction from the deer. You get a flood of eosinophils, those same cells involved in allergies, but here they're fighting a parasite, lots of mucus production, and something called lymphoid hyperplasia, where the immune tissue in the airways grows excessively.
Wow.
All of that physically obstructs the smaller airways. It can lead to emphysema, like we talked about before, and also atelectasis, which is basically lung collapse. Plus, it makes them much more vulnerable to getting secondary bacterial pneumonia on top of it all. It really weakens their defenses.
And how would you know if a deer has lungworm? What are the signs?
You'd see a persistent cough. It's often called husk or hoos in livestock context. Difficulty breathing, maybe some nasal discharge, weight loss. It really takes a toll.
How do you diagnose that?
Diagnosis usually involves looking for the lungworm larvae in fecal samples. There's a specific technique called the Behrman technique designed for that. And the good news is treatment typically involves broad-spectrum anthelmintics, dewormers, that can clear the infection.
Okay, so lungworm is one major cause. Are there other infectious diseases that present with similar respiratory signs in deer?
Oh, absolutely. Bovine tuberculosis, or TB, caused by Mycobacterium bovis. That's a serious one. It's a chronic disease, progresses slowly.
Right.
Many deer might not show signs for a long time. They can be asymptomatic carriers. But in later stages, you can definitely see coughing, nasal discharge, difficulty breathing. Diagnosis often happens post-mortem, unfortunately, where you find the characteristic nodules, the tubercles in the lungs and lymph nodes.
A really tough one. And then there's chronic wasting disease, CWD. We hear a lot about that as a neurological disease. How does that connect to breathing problems? It's not primarily respiratory, is it?
That's a really important distinction. You're right. CWD itself, caused by a prion, is a fatal brain disease. It doesn't directly attack the lungs.
Okay.
But in the terminal stages, the neurological damage causes major problems,
Yes.
difficulty swallowing,
Hmm.
loss of muscle control. This makes the deer highly prone to aspiration pneumonia.
Breathing in food or liquid.
Exactly. They essentially inhale food or saliva into their lungs because they can't swallow properly or protect their airway. And that causes severe respiratory distress. So it's a secondary complication of the neurological failure, but it's often how they ultimately succumb. The body just forgets how to keep the airway clear.
That's grim. So, looking across these different causes in deer, lungworm, TB, CWD complications, what are the general respiratory signs we might observe, and how does diagnosis proceed?
Well, the signs themselves can look similar on the surface. A chronic cough, nasal discharge, labored breathing, maybe not wanting to move around much, weight loss, flared nostrils when breathing hard.
Right, the common indicators of distress.
Yes. So diagnosis involves putting the pieces together. A good clinical exam, getting the history of the animal or the herd, listening carefully to the lungs, auscultation, maybe endoscopy or BAL fluid analysis. Similar tools as with camelids, but the interpretation is different. You're always looking for clues pointing toward that specific underlying cause, the parasite, the bacteria, the signs of systemic failure.
So, given these infectious or secondary routes in deer, how does treatment and prevention work? It must be quite different from the environmental focus for camelids.
It really is. I mean, general good management, good ventilation, reducing dust, that's always beneficial for overall respiratory health in any animal. But it's not the primary strategy like it is for allergic camelids.
Right.
For deer, the focus has to be on tackling the root cause. If it's lungworm, you need effective deworming protocols. If it's TB, well, that involves complex herd management and regulatory efforts. For CWD, sadly, there's no treatment, so management focuses on surveillance and preventing spread.
So, symptomatic treatments.
Yeah, things like bronchodilators or corticosteroids might be used sometimes just to provide temporary relief and make breathing easier. But they won't cure the underlying infection or stop the progression of CWD. They're just supportive.
That makes sense.
And this is where it really matters for wildlife management, you see. If we connect this to the bigger picture, understanding why a deer population is showing respiratory signs is critical. You can't just treat the cough. You need to know if it's parasites needing anthelmintics, or a sign of TB requiring culling or other strategies, or CWD impacting the herd. Accurate diagnosis drives effective, targeted action.
It's such a stark contrast, isn't it? The allergic environmental basis in camelids versus these very specific pathogens or complications in deer. It really drives home the need for precision.
Absolutely.
Okay, so let's try and pull this all together. We've seen this fascinating split. Camelids, primarily dealing with a non-infectious allergic COPD, very much driven by their environment, dust, mold, ventilation, almost like equine asthma.
That's the core picture.
Then you have cervids, the deer. Their COPD-like signs are mostly coming from specific infections like lungworm or bacterial diseases like bovine TB, or even as a fallout from other devastating conditions like CWD causing aspiration pneumonia.
Precisely. Infectious or secondary causes dominate there.
And yet, despite these totally different root causes, there's that shared challenge. Both groups are pretty stoic. They hide illness well.
Yeah, that's a huge practical hurdle. Early detection is just inherently difficult in both camelids and cervids because they often don't show clear signs until things are quite advanced.
Which really highlights how important vigilant observation is, right? For owners, caretakers, wildlife managers, you have to be watching closely for those subtle early clues.
Definitely. It's a constant challenge. By the time the signs are really obvious, you're often playing catch-up, trying to manage a condition that's already well-established and possibly caused significant damage.
So what does this all mean for you, listening? Well, this deep dive really underscores just how complex disease can be across different species. It shows the critical role that both the environment and specific pathogens play in shaping health.
And crucially, it means one size definitely does not fit all when it comes to management.
Exactly. You need tailored strategies. Aggressive environmental changes might be the key for a llama with allergies, while targeted deworming protocols are essential for deer suffering from lungworm. It's a powerful reminder that similar symptoms don't always mean similar problems underneath.
Couldn't agree more. The underlying mechanism dictates the effective response.
And that brings us to a final thought to leave you with. Thinking about these really stark differences we've discussed today, allergic versus infectious causes leading to similar respiratory distress, what other health problems that look similar on the surface across different species might actually be telling us completely different stories about their biology or their environment?
That's a great question.
How might really focusing on those kinds of nuances change how we approach everything from animal care and conservation to maybe even understanding aspects of our own health? Something to think about. We hope this has spurred your curiosity to keep exploring these fascinating intersections of biology and medicine.
Thanks for joining us.
We'll catch you next time on The Deep Dive.